If you're watching this, there's a good chance you care about your health and you're trying to prevent serious problems down the road. So stay with me, especially until the end, because one decision meant to reduce heart attack, stroke risk is often delayed or avoided out of fear, uncertainty, and that delay can matter. So just this week, I was talking with a patient with high cholesterol, and they were at moderate risk of heart disease. And when I recommended considering treatment for high cholesterol with a statin, which are drugs like atorvastatin, like Lipitor, rosuvastatin, Crestor, simvastatin, which is Zocor, they immediately declined. Not because they didn't care about their health, but they had heard about side effects and they just generally had a bad impression about this types of medication. And that reaction is very common, and that's what I want to address today. I'm Dr. Lola Ashaye. I'm a board-certified family and lifestyle medicine physician and founder of InTouch Primary Care here in Sugar Land, Texas. And generally, in my practice, I like to help people take as little medication as possible. And I know that starting medication is not an easy decision. It's rarely anyone's favorite thing to do. And some hesitation is normal. But with these types of medication for cholesterol, the statins, the Lipitor, Zocor, um, Crestor, the hesitation is often stronger because the messaging around them can be confusing, it can be scary. There's a lot of rumors around it. And it's a very, very common medication. So a lot of people take it. So there's a lot to say. So today I want to walk through this. So to help kind of a framework for how you can think about it to see whether this is um, whether the benefits outweigh the risk for you, because that's really the question most people have. Do the benefits of taking this medication outweigh the risks of this medication for me? Okay. So as I mentioned, high cholesterol is extremely common. The tricky part about it is you can't feel it. And the only way to find out is by doing blood work to see if your cholesterol is high or not. The other tricky part about it is it takes years, sometimes even decades, before it causes problems. So the issue with it, though, is when high cholesterol is left untreated, it's quietly damaging arteries, which increases the risk of things like heart attacks, strokes, and other heart disease. So it builds silently and then it strikes suddenly. And that's why the decision about treating it is so important, even when you feel well, okay? Because most of the time you feel well when you have high cholesterol until something happens. So the way to treat high cholesterol, there are many ways. There are a couple of ways. Lifestyle changes, of course, is foundational. However, statins are also an important piece of that treatment of treating high cholesterol, and often first line in terms of medication. Statins work because they lower bad cholesterol, which is the LDL cholesterol. But that's not all they do. They also reduce inflammation in the blood vessels and they stabilize plaque, making it less likely to rupture. And we know that this bad cholesterol, LDL, plays a central role in heart disease from studying people that have what we call familial hypercholesterolemia, which is a genetic condition where the LDL is very high from a very young age. And for those people, even without smoking or diabetes, they develop heart disease very early. And it tells us that LDL, that bad cholesterol, truly matters. There are many other types of cholesterol that we test in your blood, but all those are part of the story. Not one of them by themselves tell us the whole story. So we use all of them to make a decision, but we know that LDL is important as well. So we know that by lowering your LDL, reducing inflammation, stabilizing plaque, and more, statins lower the risk of heart attacks, strokes, and they reduce the overall risk of dying, especially in people with increased cardiovascular risk. And there's very little debate about whether statins work or not. They do. Okay. The debate is about whether it's going to be beneficial for an individual person. So we know that statins are also much more effective than lifestyle changes in terms of lowering LDL cholesterol, right? So most statins will lower your LDL by 30 to 50%. Meanwhile, with the best lifestyle changes, most intensive lifestyle changes, it lowers LDL by 5 to 15%. So that difference matters, 30 to 50 versus 5 to 15, okay? But it matters especially depending on what your starting LDL is. If your beginning LDL is high, right, and your cardiovascular risk is high, then of course, lowering it by 50% is very helpful. If it's not that high, right, then lowering it by 50% may not be that make as much as of an impact. So think about it this way. Say you have two people. One of them have moderate risk for heart disease. So they feel fine. They have some risk factors, but not many. Let's say that their chance of having a heart attack in the next 10 years is 20%. Let's compare them to a second person who has high blood pressure, diabetes, they have a strong family history of heart disease. Let's say their 10-year risk of heart disease is 40%. Okay, so a statin, Lipitor, atorvastatin, Crestor, rosuvastatin, zolgensma will help both of them, right? Because statins, for every 39-point drop in your bad cholesterol, statins will lower the risk of a major cardiovascular event by 20 to 25%. Okay, so for the person at moderate risk, the statin will lower their risk from that 20% to about 15, 16%. Okay. However, for the person with a higher risk, that same relative reduction lowers their risk from 40% to say 30, 32%. So their risk reduction is more. One is 20 to 15, the other one is 40 to 30, right? The statin is doing the same job in both people, but when the statin risk, when your risk is higher when you start, the impact is bigger, right? So in other words, the higher the 10-year risk of heart disease or stroke, the more likely that a statin is going to make a meaningful difference for you. And this is an important point. So if you need to listen to it again, it's really important to understand that how high your risk is will determine how much the statin is going to help. Okay. The other thing to consider is that statins do not eliminate risk entirely. They just reduce it. They meaningfully reduce it, but it's not zero. Lifestyle changes reduce cardiovascular risk and provide additional benefits. So yes, statins lower your LDL better than lifestyle changes can. However, lifestyle changes provide additional benefits through multiple pathways by reducing your blood pressure, insulin sensitivity, improving your insulin sensitivity, improving your, getting you towards a healthy weight, reducing inflammation. So lifestyle changes lower your cholesterol to some extent, but they also lower your overall risk of heart disease. So when you're taking a statin, it really doesn't cancel lifestyle changes. It doesn't mean you can continue to smoke or eat poorly or be inactive or allow stress to, consume you, because lifestyle changes with statins are the best way to lower your overall cardiovascular risk for those that will benefit from a statin. Okay. Another critical point is statins are not a quick fix. Excuse me. So for primary prevention, meaning you've never had a heart attack or stroke, studies show it takes 2.5 years of consistent statin use to prevent one cardiovascular event. That matters means that statins are generally intended for long-term use, and also that they may not make sense at every stage of life. This is why statins should never be started automatically or continued indefinitely without reassessments. So the alternatives without reassessments, right? So it's important to, from time to time, just check in with your doctor and find out, does this still make sense for me to continue this medication? Okay, so those are important questions to ask. So yes, there are alternatives that lower cholesterol numbers. So you may be asking, what if what else is there if I still choose not to take a statin? The issue we have with these alternatives is most of them do not have the same level of evidence showing that they reduce inflammation, stabilize plaque, or prevent heart attacks and strokes. So they can lower your cholesterol. However, does that translate into meaningfully fewer heart attacks, fewer strokes, longer life? And we don't have that data for the alternative supplements and medications out there as much as we do for statins. There are other medications that do it, but not as well, and they do not have the same level of evidence. And that's why statins have remained the foundation of cholesterol treatment for many people. A quick important point I want to make is for women. Early studies included more men, which raised concerns, and later data shows that women with elevated cardiovascular risk benefit just as meaningfully. So risk is more related to benefit is more related to your risk than to your gender. Okay, so if you are maybe already taking a statin, you're considering it, you have high cholesterol, you've been told, and you're trying to decide what to do, here's a way that you can think about it. Here's a framework. First, what is my actual cardiovascular risk? Is it low, moderate, or high? So I'm not talking about just your cholesterol number. I'm talking about your overall cardiovascular risk. So your doctor can actually help you calculate that using validated tools. We can calculate a 10-year cardiovascular risk based on several factors, including your age, your blood pressure, your cholesterol, whether or not you have diabetes, and all of that. If your risk is low, you likely do not need a statin, okay? So that's number one. So not just based on your cholesterol numbers, also based on your cardiovascular risk. Number two, if your risk is high, as we just discussed earlier, for most people, the benefits will outweigh the risks of taking the medication. And then if your risk is moderate, now that's where this next question matters the most. Question two, what are potential side effects? Which ones are real and which ones are misunderstood? Because this is really important, and this is why a lot of people hesitate because they've heard things. We don't have time to go into all the details of all the different things that this medication could potentially cause. However, here are the common concerns: muscle aches, diabetes, liver disease, dementia, cancer. These are the ones that tend to come up. So let's talk about muscle aches. Muscle aches are the most common concern, and there have been large studies done about this. Muscle pain is reported at nearly the same rate in people taking statins and those taking placebo, meaning that most muscle aches are likely not caused by the statin. But there are statin-related muscle symptoms, and when these happen, they usually happen within the first year of taking the medication. But the good news is they improve when you adjust the dose, sometimes when you switch the type of statin you use, or when you take it with other supplements, or when you stop it, right? So the risk of permanent muscle injury is extremely rare. So when you're taking it and you're taking it, with a doctor who is monitoring it properly, your risks are pretty low in terms of muscle problems. Okay, let's talk about diabetes. So we know that statins can raise blood sugar and may bring diabetes to light earlier in people, but these are for people that are already at risk of diabetes. So if you're already at risk of diabetes and you take a statin, diabetes may be diagnosed earlier than it ordinarily will by a few weeks, okay? For new diabetes in people that are not at risk, that's pretty rare with statins. So the benefit typically outweighs the risk because statins reduce heart attacks and strokes, which is the major complication that we're concerned about when people have diabetes anyway. So many people with diabetes can safely take a statin. What about serious liver injury? This is really rare. If needed, your labs can be checked, but again, it's really rare with statins. What about the big ones, cancer, dementia? Large studies do not show that statins cause dementia or cancer. These are conditions that are very common in the general population and that occur as people get older. So the same population taking statins are the same population that's likely to develop these conditions. And so it's not unusual that they exist together, but association does not mean it is actually causing it. It doesn't mean causation. Okay, so when you step back, the risk a lot of people worry about are often not risks that actually show up in high quality studies. The real proven risk of statins are relatively small. I'm not saying there are no risks, there are, but um, many of them are small risks that can be reversed or can be mitigated by when you are being followed up with a doctor that is monitoring while you're taking it. And for many people, the benefits outweigh the risks, and people delay this decision based on fear. So it's important to understand which risks are real and which risks are not. Okay, the last question is how much am I willing to change my lifestyle to help reduce my cardiovascular risk? So, regardless of what risk level you are, lifestyle changes are important, but how intensive you are going to be with the lifestyle changes matter. Because if you're at moderate risk and you're not willing to do very much lifestyle changes, then you may need a little bit more help, right? Versus if you're at high risk, well, you probably should just be on the stand regardless, and you should really make an effort with lifestyle changes. But when you are really in that gray zone, then how much you're willing to do does matter. If you're able to improve your nutrition, increase your activity, manage, um, be, get to a healthy weight, reduce your stress, you're much more likely to avoid a statin. You're much more likely to be on a lower dose. And you may be even if you're on it, you're much more likely to be able to stop it. Okay. So I hope that helps you frame, whether or not you want to start a statin medication. What's my actual cardiovascular risk, not just my cholesterol number? That helps you decide how much you're going to benefit from it. Number two, what are the real side effects? What do I really need to consider? That way you can weigh the benefit with the risk of side effects. Number three, how much am I willing to change my lifestyle to help reduce my cardiovascular risk? That will help you determine, how what you really want to do. He'll help you make that decision. So when you answer these questions honestly, you're no longer guessing. You're making an informed decision based on your real risk, not fear, not headlines, not pressure. And if you're listening to this, it's because you care about preventing heart disease. I want you to consider another question that often comes up alongside statins, and that's aspirin. And there's a video I just did about that. Should I take a daily aspirin? Because for many people, the answer is surprising. So check that out as well. So prevention is not one and done. It should never be guesswork. It can be done thoughtfully, systematically, and it should be reassessed over time. Real prevention isn't a 1-minute conversation. As you can see, it shouldn't be a rushed decision. It takes time, context, and ongoing reassessment. So if you're considering a medication that you're going to take every day, potentially for years, it's worth making sure that it's the right decision. And at InTouch Primary Care, that's what we offer: unrushed, proactive care, so that you have the space to truly understand your cardiovascular risk and decide what actually makes sense for you. So if you're in Texas, you can schedule a free 15-minute consult to learn more about our services. So at the end of the day, statins aren't right for everyone, but they can make a difference for the right person. They can meaningfully reduce the risk of life-altering events like heart disease and stroke. If you feel like this information has been helpful, please go ahead and like, subscribe, and please share with somebody that might really, need to hear this, because it could make a huge difference for them, short term and long term. The goal isn't avoiding medication at all costs. It's really making informed evidence-based decisions that support your health in the long term. I hope this helps.